I talked before about what you should do if you get cancer. Stay with your physician that you like. You know, if you choose, if you choose not to go chemotherapy or radiation, and you know the success rate, 2 to 3%,
Mm-hmm.
and you choose another way to go, because as soon as you go to that oncologist, every single solitary symptom you have from that point on is going to be caused by cancer. And everything else is ignored.
Right.
If, on the other hand, you're able to give your doctor permission, say you've refused to take chemotherapy or radiation therapy, you would just really appreciate him taking care of you and giving you the best quality of life that he can. In most states, that's enough to allow you to stay with your family practitioner.
Mm.
And most family practitioners will work with the patients.
And
And
you need a physician that understands how to read blood work and charts
yes.
and diagnostics, because you don't know what those numbers mean.
No. There are protocols that are set up for different treatments other than the normal chemotherapy. And you do need to be followed by a physician. Doesn't matter whether it's a naturopath, a good naturopath, or a good allopath. If they're a good physician,
Mm-hmm.
they can put one and one together and get two and realize what you're doing, and they'll benefit you. They'll help you.
Mm.
Their hands aren't bound, but as soon as you're in the hands of the oncologist, their hands are tied. They can't touch you again.
Mm.
They can lose their license by treating a cancer patient.
Right. And we know many that have.
Many of the best doctors
Right.
have lost their licenses. They're attacked in several different levels, from IRS to the FDA
Right.
and FTC. And there are a lot of doctors as well that are taking advantage of the fear factor. And these are doctors that are doing therapies that they know don't work, but they know that the patients know the chemo doesn't work, radiation doesn't work, so they use the fear factor to draw them into another therapy that doesn't work.
Mm.
Whether it's IV vitamin C and bicarbonate, and I'm sure you've heard of
Sure.
a lot of people doing that.
Mm-hmm.
It's nonsense. It can be shown to be nonsense, but fear is the #1 factor in treatment of cancer. Your oncologists use it. I can give you verbatim what your oncologist will say when you walk in the office. You have to look at an oncologist as a used car salesman.
Okay.
And the spiel will go something like this, if not word for word. Thank God you got here when you did. If you'd been any later, it would have been very difficult to cure you. And they will use the word cure.
Okay.
But now that you're here, we can get you started right away. How's next Monday for you?
Right.
Or, it's too bad that you waited so long to come to me. But what I can do for you is give you another 4 or 5 months. What they don't mention is if you don't do anything, you'll still have another 4 or 5, 8, 10, 12
6 or 8
months,
Right.
and you'll feel better. But these are the sales techniques.
Mm-hmm.
Uh,
And I can attest to that, because being contacted on a daily basis by cancer patients that have just been diagnosed or are in the middle of treatment, or by their relatives that after the patient has died, that story rings true. We came in today and we just got out of the doctor's office and they said it's so advanced and they want me to start chemo tomorrow. What should I do?
right.
Or my father went in and had prostate cancer, and they did the biopsy and they said they've got to start radiation Monday. What should we do? It's always a rush. There's always it's always this needs to have been done yesterday, but let's start it as soon as possible. And so they don't have time really at that point to begin to learn about natural treatments. At that time they need to already have studied Because that way they have
Right.
information they can discuss with their doctor.
That's true. That's absolutely true. I mentioned before, there are two questions that I always tell patients to ask their oncologist. When you go into an oncologist's office, I would say probably 95% are the most charming people in the world. Just like if you go on to a used...
Sociopaths are charming, aren't they?
They are all charming. And just like if you go onto a used car dealer lot, the guy that comes out is going to be nice as heck.
He's your good buddy already.
He's your friend. As soon as you ask these two questions, you start to see what the oncologist actually is. And then the first question is, can you show me research, published research, that this chemotherapy or radiation or whatever you're selling me is going to improve the quality of my life? The second question is, can you show me literature that will show me that this therapy, this chemotherapy or this radiation therapy, will make me live longer than if I take nothing?
So quality of life and then length of life, the two questions.
Right.
They won't be able to, will they?
They can't.
Yeah.
There is not one. I have studied cancer for a couple dozen years. Aside from school, I mean, really delved into cancer for about 25 years out of 30 years of practice. And the one thing that I have never seen, and I have read, at one time I was reading 25 to 30 studies a day.
You told me at one time that you believed you'd read everything that had ever been published on cancer.
I believe I probably have,
Yeah.
or had up until probably 2 years ago.
Okay.
I never saw a study comparing any therapy to no therapy, with the exception of one, and that was a prostate cancer we were discussing before, that showed no difference.